Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson, and today we're going to talk about common dental conditions in cats and dogs. There are two main problems when it comes to dental disease in cats and dogs, and it's a little different to humans. So number one is all about that bad breath. So the build-up of tartar. This is really common, and for most animals over the age of about 3, there will be some degree of tartar build-up. In larger breeds of dog, there can be very small amounts that don't appear to cause any major problems, but in some small breeds of dog, it can be to the point that essentially the tartar is about all that's holding the teeth cemented in the mouth. There is that much there. So why is tartar a problem? Well, essentially tartar is like cement, but the problem is it contains a whole bunch of bacteria and it also irritates the gums. So not only does it contribute to bad breath, but it also contributes to gum disease, so inflammation of the gums, and ultimately that can lead to periodontal disease. So periodontal disease is affecting the bone and the ligaments that are actually holding the teeth in the mouth. So ultimately, if it progresses far enough, then actually the teeth will fall out unless, like I say, they're caked in with tartar from other surrounding teeth that are still anchored in place. And finally, if the tartar is bad enough and the inflammation is bad enough, it can lead to systemic disease, because obviously that's an awful lot of bacteria and inflamed tissue. In most cases, it seems to end up contained in the mouth, but I don't know about you, I think the idea of having that much tartar and inflammation on my mouth, well, it has to be painful and it can't be healthy for your body overall. So the second common issue that we see in the mouths of cats and dogs, but particularly dogs, is broken teeth. So there can be a genetic component to this, and typically in large breeds of dog, their big chewing teeth at the back, the carnassials, it's not uncommon to see a slab fracture there, where a slab of tooth off the side breaks off, and the main tooth still seems to be there. It physically looks okay, and sometimes it will be, but sometimes when that slab comes away, it exposes the root of the tooth, and then ultimately you end up getting a tooth root abscess. The most common way that teeth end up broken, or probably realistically the only way teeth end up broken, is trauma. So that might be because because you throw a heavy object that they go and try and catch, and in the process break a tooth. It might be because they've been in a fight. That's probably more common with cats. It might be because they're involved in an accident of some description. Irrespective, a broken tooth usually ends up exposing the root. That is where the nerves are, and if you've ever had a broken tooth yourself, then you'll know the amount of pain that causes. But also it's the access way into the deeper tissues, so really easy to get an infection in there. Often the outside will seal off, so then you end up getting an abscess, and a tooth root abscess is extremely painful and difficult to live with. For some reason, cats and dogs don't seem to show perhaps the signs that we would expect from a human perspective. Having said that, they do definitely give other subtle signs, and particularly things like eating on just one side of their mouth to try and avoid hitting the sore area. So what can you do to prevent health problems in cats and dogs? Well, the first thing is being able to get them used to you having a look inside their mouths, because unless you can have a look, you've got no idea what's going on in there. So best time starts when they're a puppy, and I've talked about this previously, but being able to have a look in their mouth, best way to monitor what's going on. If you can introduce toothbrushing at the same time, that's a brilliant way of reducing the amount of plaque. So that's the softer version of tartar that builds up in the teeth and stops it turning into tartar, helps keep the gums healthier and so on. Toothbrushing can be quite involved and can be quite time consuming, however it's well worth the effort if you can. If you can't do toothbrushing, then there's lots of other options out there. Things like dental diets, the supplements, dental chews, water additives, anything that helps encourage dogs to use their teeth and reduce the amount of bacterial load in there for the tartar to build up. When it comes to treatment of dental disease, whether we're talking tartar build-up or broken teeth, if we're talking treatment, they need an anaesthetic. Anyone who tells you otherwise is not planning to do a decent job and a decent assessment of the mouth. So any treatment of dental disease in cats and dogs is going to require an anaesthetic. It might be for something as simple as a scale and polish, but if you've ever had your teeth cleaned with an ultrasonic scaler, you know it's not a particularly comfortable experience when they get below the gum, and that's where we need to go if we're going to keep these teeth and gums healthy. Obviously, when it comes to extractions, we can use local anaesthetic in humans, but for cats and dogs, firstly, their nerves are much deeper and much harder to block appropriately, but also it's not a very pleasant experience having a needle stuck in your mouth. I haven't met too many dogs and cats who are going to let me do that when they're conscious. If you've got a dog with a broken tooth, then root canals are an option if it's been a very fresh fracture of the tooth, and that's one way of considering saving the tooth, but in most cases we do end up extracting teeth instead, unfortunately. Having said that, there is a lot of very gummy cats and dogs around out there, and they're coping just fine. They're perfectly capable of eating, and usually missing those painful teeth is a much better experience for them than having a mouthful of painful teeth and infection. So common problems in cats and dogs' mouths: tartar and broken teeth, that's the biggies.